I'm Dr. Summer Gutschow. I'm a general dentist in Omaha, Nebraska, and today I'll be sharing with you some of my best practices in transitioning to an ergo loop. I would say one challenge or obstacle or fear from dentists when transitioning from a traditional loop to a ergonomic loop is that your peripheral vision is different. No longer do you see, your hands outside of the ocular, but you're seeing your assistant, you're seeing the adjacent wall. So when you're doing something like injecting, that can be maybe a little bit more stressful. So I'm just going to share with you how I would give an injection. I love looking through my loop. I think this is one of the more important times to be able to see in the most precise way possible. So the first thing that I'll point out is with a traditional loop, I would probably be right here looking at Rebecca. Go ahead and open for me, Rebecca. And I would be looking about like this, kind of curling over and looking directly at my line of sight and then injecting. Now for a ergonomic loop, the first thing I'm going to do is I'm going to tip that patient back just a little bit further, maybe about 10 degrees. I'm going to have her tip her chin just slightly. So the next thing I'm going to do is just line myself up with where I'm going to inject. Go ahead and open for me, Rebecca. So I'm going to make sure in a neutral position that I can see my target. The next thing I'm going to do is I'm just going to bring my hand close to the patient in a place that feels safe to me. I'm going to turn my head and look through my ocular at the syringe, and then I'm going to follow that syringe directly to the patient's mouth, right to the target. If that makes you a little nervous, another tip would be to, if your assistant has a headlamp, I have her point it right at that syringe, and then I can see that light coming right into focus. I look at my syringe and I bring it right to the target. Another concern that I've heard or that I experienced with a different peripheral vision or a peripheral vision that is, up a little bit higher than where your actual focus is through the ocular, is that what if the patient's moving? What if it's a kiddo that is moving from side to side? Go ahead and move for me, Rebecca. You're a kid, right? So now instead of a traditional loop where I'm following that patient like this, it looks like this, right? I can follow that patient still. I can chase that kiddo, right? Or go ahead and be still. If it's a patient and we're worried, hey, can that patient feel what I'm doing? Are they experiencing any pain? This is where having a great assistant comes into play, right? I'm focused on the tooth, whether I'm using a traditional loop or an ergonomic loop, but Allie is focused on the patient. She's watching the hands, she's watching the eyebrows. Is that patient comfortable? Another thing that I would encourage is instead of coming in and out of your ocular focus, have your assistant bring things nice and close to the face so they're in your scope of view, right? So she brings my Dappen dish right here. Any sort of armamentarium is going to go right near the patient, so I don't have to go in and out of my ocular. I think for some providers it can be a little disorienting, kind of looking around the ocular, at least at first. I'm comfortable doing that now, but in the beginning stages as you're getting used to it, rely on that assistant to bring things nice and close so you don't have to go in and out of your focus.